Hey, hello everyone. Thank you so much for attending this webinar. Let me okay, perfect. So we will start the webinar now. I think people are still joining in and hopefully they'll keep joining in during the presentation. So my name is Noor Al-Isa. I'm a clinical psychologist and I have emphasized in family therapy. I work in National Guard Hospital and I deal with a lot of families that are going through several mental health disorders from anxiety, depression, obsessive compulsive disorder, and other mental health disorders. But I also deal with a lot of healthcare professionals and staff. And a lot of the work is about their stress levels. And since my time in National Guard, which has been over 10 years, I've noticed that stress is always significant around healthcare workers. And so today's topic is about your stress as a healthcare worker and understanding it more and ways to reduce it and manage it. So the topics covered. So basically, in general, we all feel some sort of stress in our lives, and it can definitely impact our ability to self-regulate. So stress is comorbid with physiological symptoms. And so once we feel stressed, it affects our body, it affects our mind, which we'll discuss a little bit later on in the presentation. And so it's important to discuss the topic of self-regulation, which we'll also be discussing a little bit later on through mindfulness and breathing exercises. And the idea is that without understanding how stress impacts us and what the sources of stress are, and without the application of coping strategies to help with our stressful lives, it can make us feel disconnected and overwhelmed. And what I will be covering in today's topic is I will be covering a few past research studies on healthcare worker stress levels within Saudi Arabia. And I will also be talking about understanding stress generally and as well during the COVID-19 pandemic, which is something that we're all facing now. As well, I'll be talking about the sources of stress and coping strategies on ways to deal with stress. And then lastly, which was the earlier topic I was talking about, is learning to feel connected and regulating during those moments of stress. The idea is that even if it's not during those moments of stress, it can still be building blocks for future encounters of stress. And it can be a preventative measure for future obstacles. So first, I want to start with a survey exercise that I hope I can have the majority of the audience participate in. It is a series of 5 questions, and one of our panelists, Muhammad, will kindly enough display the first picture of the survey. So let me just see if he can. Ustad Muhammad. Sorry guys, if you can bear with us. I'm just trying to see if one of the panelists can display the survey. Okay, he's telling me to wait a few seconds. So sorry about that. But basically, I think it's host. So basically, okay, perfect. We got the survey up and running. So you can answer this survey on the spot. And the first question is, do you currently feel stressed? Sorry, there is a spelling error in that word, but it is, do you currently feel stressed? Yes or no? So I urge every audience member to try to answer this quick survey and we can kind of collectively see how everyone's stress levels are. We'll give like a minute to each question. Okay, now that the first question hopefully has been answered, we'll go into the second question. So do you feel that your stress levels have increased, decreased, or again, sorry, there's a spelling error there, or stayed the same during the COVID-19 pandemic? Okay, and we'll be going on to the third question. Where do you feel most stressed? Is it at home, in the workplace, or in both environments? Okay, I think we can go on to the next question, Mohammed. So question 4 would be, how would you rate your stress levels? Are they mild, moderate, or severe? Oh, sorry. And finally, the last questions. Do you feel that you're applying coping strategies to deal with your stress? Yes or no? So Mohammed, since it's a yes or no, yeah, I think we can go on to the results. So I'm kind of intrigued to see what the majority has felt. So do you currently feel stressed? The majority of the audience does currently feel stressed, and that's about 64% of you guys. And do you feel that your stress levels have increased, decreased, or stayed the same during the COVID-19 pandemic? And again, the majority feel that their stress levels have increased during this time, with 11% feeling that their stress levels have decreased, which is quite interesting, and 26% felt that it stayed the same. And where do you feel the most stressed, which is something that I was expecting? It's in the workplace. Since a lot of you are healthcare workers, you're more prone or at risk for what's going on, and 56% feel that they're the most stressed in the workplace. Okay. And how would you rate your stress? So everyone kind of is within the moderate level. So, but in general, it seems like everyone does feel some sort of stress. So there's mild stress, which is 38%, moderate, 54%, which is the majority, and severe, which is at about 8%. And lastly, which is kind of an important question for me, is do you feel that you're applying coping strategies to deal with your stress? So it makes me happy to see that the majority of you are applying coping strategies to deal with your stress, which is a very, very good thing. And I think towards the half end of my presentation, it will be all about coping strategies. Okay, great. Thank you, Mohammed. Okay. Thank you all for participating in that survey. It definitely gives us a little bit of a clearer image on your stress levels. So I think going into the topic of research studies, I found some local research studies here in Saudi Arabia to give us a little bit of an impression of stress levels that are present amongst healthcare workers before the COVID-19 pandemic. We'll get to some of the research studies during the COVID-19 pandemic. So the first study is about the patterns and determinants of stress among consultant physicians working in Saudi Arabia. So I'm not sure if we have some consultant physicians with us, but it was interesting to see some of the results. So the aim was to examine the perceived stress, the risk factors, and the consequences among consultant physicians. The population was actually quite well. It was a total of 582 with the average mean age 47 years old, and the gender were mostly males. Saudi physicians were the majority of the study, being 56%, while non-Saudi consultants were the rest of the population. And it was from all medical specialties, and it was from both public and private sectors. And it covered the 5 Saudi regions, the central, northern, southern, eastern, and western. And they were all registered with the Saudi Commission for Health Specialities. The method was a cross-sectional study done in 2014 to 2015, and they used the perceived stress scale to measure the stress levels. So the results were interesting. The majority of consultant physicians, 85%, found that their job environment was to be the most stressful. And 50% of that felt that they had a high workload and a non-cooperative administration. This was also interesting. So higher stress levels were significantly associated with being younger, female, and Saudi. And higher stress levels were significantly associated with encountering life stressors. They didn't mention what kind of life stressors, and experiencing passive suicidal ideation, which was tied to depressive symptoms. So they concluded in the study that consultant physicians in Saudi Arabia experience moderate to high levels of stress that are apparently comparable to physicians worldwide. And they recommended that further studies are required to assess physician-based interventions and organization-directed approaches to management of stress among physicians. Now going into the second study, we have stress amongst residents in a geriatric care center in Riyadh, Saudi Arabia. The aim was to examine their perceived stress among medical and surgical residents. And the population was 87 residents out of 104, with the average age of being 27, and they were all taken from King Fahd Medical City in the surgical departments and medical departments. And they were all registered with the Saudi Commission, and there was a mean geriatric care experience of about 2 years. It was a cross-sectional study that was done in 2016, and they used the Kessler tool to measure their stress levels. And the Kessler tool basically measures stress in the past 30 days. So the results were also interesting. 58% of the population of residents in King Fahd Medical City felt that they had severe stress levels, which was the majority. 33% felt that they had mild to moderate stress levels, and 8.6%, which was the least amount of people, felt that they had no stress. And again, higher stress levels were associated with the female gender. But this time it was different. It was associated with non-Saudis rather than Saudis. And it was in the surgery department that had higher stress levels and R5 residents. And like I said before, the total stress levels were associated with stress during the past 30 days. And it was significantly correlated with residents feeling that they were unable to work in the past 30 days. And the results showed that residents in Saudi Arabia are at comparable or even slightly higher risk of residents worldwide. And they urged that there is a need for stress management programs during residency training. And the last study is perceived stress and associated factors among medical students in Riyadh. And the population were 80 medical students from King Fahd Medical City as well, batches 9, 10, and 11. And they also used the Kessler tool, and it was a cross-sectional study in 2016. And the results showed that 33% had severe stress levels, and higher stress levels were associated with the female gender and them being younger, junior level. And the factors that affected the students' stress scores were nervousness, feelings of hopelessness, feelings of restlessness, and feelings of depression. And they concluded that implementation of coping programs is necessary during medical school. And basically, I want to ask, I don't know if we have time, or maybe we can kind of cover this towards the end, is what similarities do you see in the 3 studies that were mentioned? I'm going to look quickly at the Q&A to see if people can answer that question, is what similarities do you guys see in the 3 studies that were mentioned? So females are stressed out, yeah. It was mostly females and younger. So why do you assume that more females were prone to having stress? So you guys are correct. The female gender was more at risk for being stressed, but it doesn't mean that males are not stressed in the study. So basically, studies have shown that females are more at risk due to a few reasons. One of the reasons is that it could be attributed to biological differences. So some women experience depression-related illnesses like premenstrual depression, postpartum depression. And so some changes in the hormone could attribute to an increase in prevalence in women. That's one. A second is that the triggers for depression appear differently in genders. So women have a tendency to internalize symptoms more. So for example, with withdrawal, while men present symptoms through externalization. So anger, for example. And so that's why we can see higher rates of depression, anxiety in females. But more importantly than that, I think the biggest similarity that I saw across all 3 studies is that in all stages of medical school, from being a medical student to being a resident to being a physician, that stress was prevalent in all stages. And I think that's something important to remember, is that it is the type of job where stress is always going to be a factor. So now imagine dealing with COVID-19 pandemic with a virus. So it'd be interesting to see as well how healthcare workers' stress levels have changed during the COVID-19. So from the survey that we did a little bit earlier, a majority of you guys have felt that your stress levels have increased during the COVID-19. There was a big study in China done. It examined 1,257 participants, and they were ages 26 to 40 years old. Majority were nurses, and physicians equated for 39%, and 60% worked in hospitals in Wuhan where the infection started, and 41% were frontline workers, which were dealing with active COVID cases. So the results were quite significant. 71% of the population of the study reported feeling psychological distress. 50% reported symptoms of depression, 44% reported symptoms of anxiety, and 34% reported insomnia. Now, nurses, women, frontline healthcare workers, and those working in Wuhan themselves reported more severe degrees of all measures of mental health symptoms than other healthcare workers, which makes sense. They're frontline healthcare workers and they're working in Wuhan. And we just talked about women being more at risk. And so they measure to be of the higher population. There was another study done in Singapore, but this was interesting because it showed that non-medical staff, so non-physician, non-nurses, it was allied healthcare professionals, pharmacists, technicians, clerical staff, maintenance workers, showed significant rates, higher rates of stress than physicians and nurses. And basically they attributed that to something. So they did a study a few years back on SARS outbreak. And during that pandemic, physicians and nurses had higher rates of stress. But during the COVID-19, they weren't as stressed as they were during the SARS outbreak. And they attributed that to them being better equipped during this outbreak. And non-medical staff were not. So the factors were that they had reduced accessibility to psychological support, and they had less firsthand medical information on the outbreak, and they had less intensive training on personal protective equipment and infection control measures. So they felt that they were not ready to take on such a pandemic, and that's why they had higher rates. And of course, I do want to cover this subgroup because, you know, every healthcare worker is affected. The pharmacist, the speech therapist, the mental health practitioner, the nurse, the physician, and that's why everyone's kind of called the healthcare hero, because, you know, at the end of the day, you're still putting yourself at risk by going to the hospital and treating patients. And it just goes to show that everyone's stress level is affected during these times. So enough about research studies. I know I went a little bit heavy on the topic, but the idea on why I covered these studies was to show that healthcare workers are constantly going to be dealing with stress, whether it's during a pandemic or on a normal day on the job, as the studies have shown and as the research has shown in the past. So it's really important to understand how stress impacts us. And the idea is because we'll be dealing with stress on a daily basis, it's not the stimuli or the body's response that can define stress, as that's constantly going to be firing, but it's rather the process by which we appraise and cope with the environmental threat or challenge. And this was stated by Lazarus and Folkman. They created this appraisal diagram, which I'll be going into. So basically, we have a situation or event, and we go through a primary appraisal. An appraisal just means to evaluate and to assess. So once we assess the situation or event, we cognitively process, is this a perceived threat or is it not a threat? If it's not a threat, then there's no stress. If it is a perceived threat, then we go through a secondary appraisal. Now, the secondary appraisal means it's the evaluation of the resources available to cope with the problem. And once we try to evaluate what resources we have, then we have the perception of either the ability to cope with the stress or the inability to cope with the stress. Now, if we feel like we don't have that ability to cope with the stress, then we are more prone to negative stress. Negative stress is unpleasant. It's disease-producing stress. While if we have the perception that we have the ability to cope with stress, then we have positive stress, which is that pleasant, controlled stress that gives us kind of our competitive edge or performance. For example, a job interview or my presentation currently, but it's that positive stress that keeps us focused and motivated. So that was our topic about kind of understanding our perception on the ability to cope with stress. Now we go through 3 stages in our response system to stress, and this was adapted from Selye, and it was the general adaptation syndrome. And basically it describes how humans respond to stress. and we respond to stress on 3 phases. So the first phase is the alarm phase. And the alarm phase is when the threat or stress is identified and the body stress response system is in a state of alarm. So, we always talk about the fight or flight response system. And basically, that's when the sympathetic nervous system is activated. So your heartbeat is beating faster, your breathing is a bit heavier. Basically, your body kind of acts like an alarm system. And then we go through the resistance stage, which is the second stage. And that is basically our ability to find means to cope with the stress. So our body tries to adapt to the strains and demands of the environment. But the problem is that if the stress is prolonged, then the body can't keep up using its resources. And so at one point, the resources will be gradually depleted. And once that happens, we go into the third phase, which is the exhaustion phase. And then that's when the resources are depleted. And once that happens, then that's when long-term damage can occur and illness can occur. So summing it up, basically, there is positive stress, which is where you feel motivated and focused, and you feel that you can kind of cope with the stress and achieve whatever, tasks that you have at hand. But then once your peak performance is reached, and once your coping strategies aren't being utilized and your resources are being depleted, that's when you feel stress overload, and that's when you feel fatigued and exhaustion sets in. Once that happens, anxiety, anger, depression, burnout, and breakdown occurs. And once that occurs, then the result can manifest itself in disease and illness. So the symptoms of stress can affect our entire being, cognitively, behaviorally, emotionally, and our physical bodies. And for example, our body reacts through breathlessness, headaches, fatigue, muscular tension. Emotions can vary from depression, anger, anxiety, loss of confidence. And our mind can wander off into a negative state, negative worries, nightmares, inability to concentrate. Behaviorally, we might be accident prone, overeating, undereating, sleeplessness, substance abuse, smoking, drinking. And the idea is that being aware of these symptoms can also help be a preventative measure for relapse before burnout. And sometimes people get these symptoms, but then they ignore them since they're just used to being on the go. So developing that type of introspection and looking within, being aware of your body, being aware of your mind, what's going on in those states can definitely help slow down the progression of further symptoms and hopefully burnout, and then hopefully for the prevention of illness and disease in the future. So now kind of understanding how stress impacts our bodies and our minds, it's important to discuss what are the sources of stress that are around us. So we have our environment. Our environment is basically any stimulus in the environment that is causing us stress. Examples of that would be like traffic, being stuck in traffic, noise, changes in temperature that would affect your body and your mental state, natural disasters, war, being in a war zone, and currently pandemics. So, and I know Saudi has faced a lot of issues, we are in a war zone, and we are dealing with a pandemic, and so our environmental stressors are at a high. And it's important to kind of talk about what stress factors healthcare workers are dealing with during COVID-19. And I'm not sure if you guys can relate to this, but I know that there are longer working hours currently, and there's longer shifts, and that can lead to faster burnout, especially if there's no downtime or rest time. There are concerns over one's safety during these times, and even thoughts about mortality. So there's genuine concerns that you might contract the disease during, one of your days at the job. And because other healthcare workers have contracted COVID, during the job. For example, some healthcare workers in China and Italy and the US have contracted it, but also passed away from it. It warrants a concern over one's safety during these times. Another issue that healthcare workers are facing is making difficult decisions. And I know some cases in Italy had to basically choose who would receive healthcare and who wouldn't. Their healthcare system was kind of collapsing at one point. Their hospitals were full, there were no beds to treat patients, there was not enough ventilators. And so, as healthcare workers, your goal is to always treat every patient. And so they had to make very difficult decisions on who receives care versus who doesn't, depending on who had a better chance of surviving. So those were some of the examples of some of the difficult decisions that they had to make. Another one is witnessing traumas and emotional turmoil. So it can be quite traumatic. In some cases where healthcare workers witnessed elderly die alone since family members were not allowed to visit them during their last days. And it was significantly tough for nurses to have to bear that news to the elderly. And there were some families as well that chose not to visit because they were afraid that they can contract the disease. And those type of experiences kind of carry a heavy load. As well, another stressor is that there are psychological burdens that come with the decision of self-isolating from loved ones. So especially frontline healthcare workers that are dealing with active COVID-19 cases have decided to self-isolate from their families due to a concern that they might, pass on the virus to them. And so making that decision to self-isolate during these times can be lonely and can definitely add pressure. So all in all, these are factors that can not only affect job performance, but someone's physical and mental health well-being. There have also been a lot of studies that have shown there is a psychological impact of quarantine itself. There was a study that reviewed 24 research papers, and basically it found that there are negative psychological effects to quarantine, to self-isolating, which include, post-traumatic stress symptoms, confusion, anger, exhaustion, detachment from others, anxiety, irritability, the list goes on, poor concentration, deteriorating work performance, and even a reluctance to go to work. And they found this pattern from majority of the pandemics that have occurred, SARS, Ebola, pandemics that required quarantine. They found that there are tremendous psychological impact on an individual, and especially now in COVID-19, the same pattern has recurred. Now, the Ministry of Health did a report 2 weeks ago between April 11 and April 18 in Riyadh. And they reported that 180 healthcare workers have contracted COVID-19, and 145 of them contracted it in a healthcare facility, so during their working day, and 35 contracted it socially, but they didn't specify. So that within itself shows that, healthcare workers' concerns are quite valid. And alhamdulillah, the 180 healthcare workers, there were no mortality rates amongst that. It was just contracting the disease, and they were able to get treated. So the idea is that as a healthcare worker, you're trying to find the balance between facing the challenges of protecting yourself, protecting your family, and then also doing your job. And that alone is a heavy burden to carry. That is why I salute, honestly, all healthcare workers during this time, because I know it's quite tough to balance all aspects. Another source of stress, and I'm positive you know all this, is body abuse or neglect, which entails kind of an unhealthy lifestyle. So poor nutritional habits, poor sleeping habits, lack of rest, lack of exercise, And substance abuse, smoking, and other substances can definitely have an impact on your body and mind, and can be another source of stress, a hidden stress that can carry a heavy weight in time. The third source of stress is the mind, which I want to talk about a little bit further. So the mind is everything. It is your portal to success, and it is also an obstacle. And how we think affects how we feel, and it affects how we react. And those are highly, highly correlated. So for example, let's say you have this negative thought cycle that, things are too much, or I'll never finish, or it's unfair, and you have this negative cycle of thinking. Of course, it's going to elicit negative feelings like irritability, anxiety, and anger. Once you have those feelings, you're more prone to react in a negative behavioral cycle. So for example, rushing through tasks, unable to relax, shouting, being aggressive. And the idea is, because they're so correlated, then we also have the capability of changing our mindset. And if we change our mindset, then hopefully we can change how we feel and how we react. So some unhelpful thinking styles, which we call cognitive distortions, these are just some examples. There's so many more, and I urge you to read about cognitive distortions, is, for example, like all or nothing thinking. So, if I get a bad grade on this assignment, then I will never understand, this type of work. Or, for example, basing your thoughts or reality on emotions. So I feel alone, that means nobody likes me. And basically these cognitive distortions can affect the way you think, which in turn, like we said, can affect the way you feel and how you act. So this was really interesting, and I wanted to share this with you. There was a research study that showed, so we know generally through research that high amounts of stress can lead to chronic illness. But what was different about this study is that it showed that the high amounts of stress and the perception, so the belief that stress impacts our health, are associated with poor health and mental health. So basically, individuals who perceived that stress affected their health, individuals that truly believe that stress affects their health, and of course had large amounts of stress, had an increased rate of premature death. And it was just crazy to me to see that the belief within itself has such an impact on your mortality rate, on your future outcome in regards to your physiological state, chronic illness. And so I found that really interesting, and I wanted to share that with you. So now we can talk about the coping strategies, which is the main aspect of this presentation. So going back to the sources of stress, so our environment, there are some things that we can control and that we can't control. So it's important to understand what is in my control and what is not in my control. So the COVID-19 pandemic, it is something that is not in our control, but there are still some things that we can do to control it. But before getting into the COVID-19, I want to talk about generally what you can do or implement in your daily life. So making small changes is something that we negate. We think that we have to make big changes, or have to achieve something so grand for it to cause any form of ripple or a ripple effect. But the idea is just making small changes can truly affect your routine and how you see things. So small examples, for example, if you're having a really long work day and then you're coming home from work and you're the one who's teaching the kids right away and having to do their homework. And sometimes I know a lot of moms deal with that. It can add a lot of stress to them. So sometimes delegating house tasks to someone else, sharing responsibilities, for example, changing the time, the homework time to another time, changing some sort of small routine can have a huge impact in your day. Another factor that can help that is within our control is communication. We forget about communication. So sometimes stress is correlated to people, and it's caused by people, and whether it's an employer or a coworker. And a lot of it arises from miscommunication. So kind of identifying that and working towards transparency, good communication, that's key in helping stress levels, especially in the workplace. Time management is also another one. So stress often results from feeling that you don't have enough time to accomplish all you can in a given day. And sometimes it's not the lack of time, but it has to do with time management. Now, of course, I know there are healthcare workers that are working on the clock and they don't even have time to breathe. But the idea is these are just kind of general topics to think about on, you know, what my day looks like and what are some things that I can change in my day that can maybe possibly decrease my stress. So for the COVID-19, as we said, there's things that are not in our control, but there are things that are also within our control. So decreasing the news, it's definitely important to be updated and it's important to know what's going on. But the habitual habit of watching the news, you know, during the day, during night, during many aspects of in the hours of your day is just is stress provoking. And so the idea of decreasing, you know, watching the news can be helpful. Also, you know, taking precautionary measures of hygiene, we've heard that from the beginning, but it is something that is in your control. So washing your hands a few times a day and kind of keeping up those measures can really help kind of feel that you are a little bit in control. And creating a support system is really, really important. So we're all practicing social distancing right now, but it doesn't mean that social distancing means lack of social connectedness. And this is where I guess technology does come in handy. And there are means to stay connected with people, whether it's through voice, phone calls or video calls. But the idea of creating a support system is really important so that you don't feel that you're alone during these times. I can't emphasize a good night's sleep, especially for healthcare workers that are working on the clock, resting and maintaining good sleep cycles between shifts. Even taking short breaks during your day is really, really important. Finding time for personal hobbies and personal pleasures. This is the time now to kind of look into things, you know, hobbies and things that do add positive affirmations to your daily life, whether it's reading, puzzling, drawing, things that do add value to you and make you feel better. And I know that, you know, we're not supposed to be outside, but nature does play a key role. And a lot of people that have found that, you know, watering their plants or even sitting outside in their garden has significantly had an impact on their psychological state. And there have been studies that showed that nature and connecting with nature has an impact on your stress levels. Going back to that source of stress of body abuse and neglect. So ways to kind of help cope with that source of stress is maintaining a healthy and balanced lifestyle, exercise, yoga, keeping up a good nutrition. So when we're stressed, we have a habit of eating stress-prone foods and junk food because it makes us feel better during that moment of time, but it can significantly make us feel worse in time. So avoiding stress-prone foods, having snacks, healthy snacks during the day can really help. And implementing relaxation and breathing exercises and meditation during your day can also be helpful. And we'll hopefully, towards the end of the presentation, go through a collective breathing exercise to just give you an example of what that might look like. And of course, avoiding substance use and abuse and trying to keep up positive coping means rather than negative coping means. So I'm pretty sure this has been discussed several times, and I'm not gonna go into it heavily, but there is a massive, significant link between exercise and mental health. There's been a lot of evidence-based studies that have shown that exercise reduces symptoms of anxiety and depression. and it releases chemicals like endorphins and serotonin that help improve your mood. And regular exercise can help reduce stress. It can help regulate your sleep, your mood, and even improve cognitive function. I know sometimes it's hard to do, but once you do implement kind of this routine and habit, then it can feel a bit easier. And you can always start with once a week and build it up to twice a week, even if it's 20 minutes, 30 minutes a day. It can significantly help reduce any symptoms of stress or depression or anxiety that you're feeling. I'm just slightly going to talk about yoga, and I know this is kind of like a new movement to people, and some people believe in it, some people don't. But there have been studies that have shown that yoga significantly reduces anxiety and depression. So it acts like a natural anxiety relief. It's not only reduces stress and anxiety, but it helps modulate the stress response system. So basically, it has a role in decreasing your physiological arousal. So as we know, when we're stressed, it can impact our body and our mind. And, our heart rate increases, our sympathetic nervous system is activated. So yoga helps decrease that physiological arousal. So it decreases heart rate, lowers blood pressure, and eases respiration. Now, going into the source of stress about the mind, it's important to identify what your stress is, what your source of stress is, like we said before, and as well what the negative thinking style is, which is what we were talking about earlier, the cognitive distortions. So am I having an all or nothing thinking? Am I labeling? Am I basing my feelings on emotions? It's also important to challenge your pattern of thinking through evidence-based thoughts, and I'll give a few examples on the next slide. And mental imagery as well can work for people. So not everyone can feel better through verbal affirmations. Sometimes seeing something visually can help make them feel better. And there have been studies that have shown people with depression, for example, if they attribute a positive image to their feeling of sadness, it can help reduce those symptoms. So for example, even imagining yourself in a safe place or in nature or on the beach or wherever your mind kind of takes you to a positive mental image, that can also help challenge some of the negative thinking styles in your mind. So identifying your stress, these are some questions that I think would be beneficial to ask. So what is the stressful event? Understanding what is my source of stress currently? How much am I stressed from 1 to 100? So not every stressful situation leads to the same outcome of anxiety or depression. So some stressful situations, for example, from 100% will have you feeling 50% anxiety producing, while other situations can make you feel that it's at 90% and that's how much anxiety producing it is. So it's important to rate your level of stress. It's also important to understand what are the external factors, what are the internal factors. So what are the things that are out of my control within the environment, and what are the things that are internally within my control. So am I withdrawing currently from the stress? And understanding kind of those symptoms. And then of course, it's really important to understand what your thought process is about the event, what is your emotion, how you're feeling, and what are you reacting to or how you're reacting. And that's when we talked about kind of the thought, the feeling, and the reaction. Challenging your pattern of thinking. Here are some examples to how you can challenge that. So what am I reacting to? Where is holding onto this belief or thought getting me towards? Is it helpful or is it self-defeating? Is it fact or opinion? Where is the evidence to this thought? Is it logical or based on emotions? And how would I think about this at another time? So when we're typically stressed, sometimes our emotions are heightened, and so we are not thinking clearly. So maybe sleeping on it and thinking about it at another time would change our mindset. And then what would I say to someone else? So imagining someone else in your position and what feedback and help can you provide to someone else? during that time. And lastly, we'll be talking about how you can feel connected and regulated with yourself during moments of stress. Now that you have kind of some understanding of how stress impacts your body and your mind, what are the sources of the stress, and what are coping strategies that you can be applying, it's also important to have that introspective awareness and being able to have that control and empowerment on feeling regulated during moments of stress. So I'm not sure if a lot of you have heard about mindfulness, and it has been a movement that has been going on for the past few decades, and it's getting more popular, and I'm pretty sure a lot of you have heard of it. So it actually has ancient origins in many cultures, and the practices all share the same essential model and intention of directing awareness to the present moment. Not looking at the past, not looking at the future, but looking at the present moment. And it allows you to observe and witness your thoughts and emotions as they're going on, and rather than immediately reacting to them. And basically the idea is that it empowers you to gain control, and that you're not simply the sum of your thoughts and emotions. And there's this really interesting theory called Somatic Experiencing. It was developed by Dr. Peter Levine, and it was a form of alternative therapy for people who have gone through post-traumatic stress disorder and other mental and physical trauma-related health problems. And it focused a lot on the client's perceived body sensations, and it really helped with the resolution and healing of trauma. Now, the interesting part that I found within the theory is that he based his theory by observing wild prey animals, and he found that they're rarely traumatized. Wild prey animals face a lot of threatening experiences. I'm not sure if you've seen kind of National Geographic videos or you've experienced it in the wild, but if a lion is chasing a prey, then many a times that animal can play dead. It can completely find innate mechanisms within their body to discharge high levels of stress. And after they play dead, the lion is biting on their neck and believes that they are dead, puts them down for 1 second, and then you see that prey animal running as soon as the lion was distracted. And the idea is that they can shut down their body during such a traumatizing time was astounding. And he basically was saying that individuals can have the same access to their own built-in immunity to trauma. The thing is that makes us a bit different is that animals don't have those past experiences and complex emotional processes that we have faced, but it still allows you to kind of think, there are ways to regulate and discharge unwanted emotions. And allowing yourself to regulate your heightened emotions rather than having them regulate you is truly a sense of empowerment and control that hopefully, with practice, someone can achieve. So the idea is that somatic experiencing is the same model, uses the same models as yoga, as mindfulness. It focuses on introspective awareness, meditation, and self-regulation to decrease that physiological arousal state during stress. So I want to do something which is a breathing exercise, and this might be the biggest audience that I will be doing this to. And I was actually supposed to be doing this to an audience where everyone's physically present, which would have actually been way more distracting. And so now that I think everyone is at home and on their computers, it could actually be a good chance to be able to apply this even better. So I want you to have an open mind. It's just a breathing exercise, but I will guide you through it. And the idea is breath is everything. and your breathing can completely calm down your nervous system. So I would urge you to get into a comfortable seated position on your couch or on your chair. If you want, you can turn off the lights in the room. If you're around people, I would suggest that you go to a separate room. And basically, I just don't want any distractions to occur around you, and I want you to solely focus on yourself. So first, I'm going to give you an example of what the breath work is. So all it is that I would like you to inhale from your nose. And as you inhale from your nose, I want you to count your breath inwards in your mind. So for example, if you're breathing in, count 1, 2, 3. For example, for me, it only can take me 3 seconds to inhale, but some people can go up to 4 seconds, some people can go up to 5 seconds. Once you reach that capacity, I want you to release your breath by exhaling from your mouth while counting the same number you inhaled in. So for example, if you counted in 1, 2, 3 during your breath in, I would like you to count 1, 2, 3 as you exhale. But of course, these numbers are only in your mind. I want you to just focus on your breath. Make sure you're not forcing your breath out. So I'll give you an example. You're not exhaling quickly and inhaling quickly. I want you to take a smooth, slow breath in and a smooth, slow breath out. And the idea is for it to be comfortable for you and not to activate your nervous system. Okay, so let's start. Find a comfortable position. Try to keep your body still and relaxed during this practice. And let's start by closing your eyes. Try finding a point while your eyes are closed to focus on. This can help keep you from wandering. So for example, the tip of your nose or the top of your cheeks, feeling as though your eyes are heavy. Start by doing a body scan of yourself. If you feel any of your muscles are tense, focus on relaxing those tense muscles. Notice any sounds or distractions around you, process them, and start focusing inwardly to yourself and to the sound of your breath to help keep from any distractions. So keep doing this for a few times, find your rhythm, focus on the sound of your breath and nothing else. Inhale in and inhale out. If there are any wandering thoughts, just let them pass and bring back your focus to your breath. I'm going to stop speaking now, and I would like to urge you to do this on your own for a few minutes. Just inhale and exhale and counting your breath in and out in a slow rhythmic motion for just a few minutes. Okay. Now slowly bring your breathing back to a normal pace. Start by bringing awareness back to your body. Start by wiggling your fingers, your toes, waking up your body, waking up your mind, and gently opening up your eyes. I'm interested to see how that felt. I know some people didn't participate, which is fine, but for the ones that did participate, I'd love to hear some feedback. How was doing the breathing exercise? Okay, some people said I liked it. It feels good. It's refreshing. So that's some good feedback. I feel like I'm renewed, relaxing. Okay, my thoughts didn't stop. So that is something that a lot of people will face, is the wandering thoughts. And that's something that will take a lot of practice. But the idea is the more you do it, the more you find ways to focus on your breathing. And there's so many different types of breathing exercises. The one I gave you is counting inwards and counting outwards. But there are ones where you count a different amount to what you exhale out. So you count up to 7 and exhale out to 4, or vice versa. So I urge you to look into some breathing exercises and some relaxation exercises, because they really do help decrease that physiological arousal that comes with stress. Thank you for everyone that participated. And lastly, I want to talk about your resources. So it's really important to understand what resources are available within your own healthcare facility. So for example, I know that in National Guard Hospital, they have a hotline, a helpline for healthcare workers that are dealing with stress, depression, and anxiety. I'm not sure about other hospitals, but it's important to ask and see what your healthcare facility provides. And if they don't provide something, then maybe that is a call for you to ask them to provide something. Basically, it's an opportunity to try to seek that within your facility. Now, if you can't find something within your healthcare facility, there are community resources that are providing psychological support during these times, and I will give you examples on the next slide. And you can also create your own support system. So if you can't find something within your healthcare facility, and let's say you have difficulty reaching out to some of the community resources, then creating your own support system is really important. So even at work, let's say other coworkers that are dealing with the same stress and anxiety or depression, creating a WhatsApp group, creating a support system once a week where you guys check in on each other can really be beneficial. And lastly, if the thoughts, for example, are intruding and your symptoms of anxiety and depression are still elevated, then there is no shame at all in seeking professional help. And that can really help. I mean, we just brushed upon the coping strategies briefly, but seeking professional help can really dive into that and can help find kind of what the negative thought patterns are, what are factors in your life that are causing you stress, and ways to help cope and deal with those stressors. These are some of the community resources that I found in my research. I'm not sponsoring or supporting any of these facilities, but these are the ones that are well known in Saudi and in Riyadh, sorry, and they come from reputable centers. So the National Center for Mental Health Promotion, it offers over the phone consultations by psychologists for psychological needs, and they've also partnered up with Libya, or I think they created Libya if I'm not mistaken, and Libya offers psychological and family counseling virtually from therapists. You have Princess Noura on the bottom left corner. Princess Noura University has a family counseling center called Tarabat, and they offer brief consultations by psychologists and social workers. And then on the bottom right corner, you have Irada Complex, which used to be Al Amal Hospital. and they offer psychological consultations by psychologists for individuals and families who are in quarantine. And lastly, in conclusion, the 3 points that I would like to stress is that stress is a silent disturbance for all healthcare workers, whether there is a pandemic or not. It is something that affects us all, irrespective of what your field is within the healthcare system. And since it's constantly present, implementing self-care strategies and coping strategies is so important. So I can't emphasize self-care, self-care, self-care. And lastly, because your work entails you to constantly take care of others, you won't be able to do that unless you take care of yourself first. So I always remember that image on the plane, which hopefully we all get to fly soon and be on. But basically, if on a flight there is an incident and the gas masks fall down, you see that you always have to put your oxygen mask, I said gas mask, I'm sorry, it's oxygen mask first before you put it on the child. And the idea is that you can't take care of someone else unless you take care of yourself first. Thank you so much for listening in, and I really hope I was able to provide something out of this presentation. And I think now we can open up for questions to the audience that I can try my best to answer. So I'm not sure if Mohammed or some of the panelists can help me with the Q&A. I'll also open up the Q&A box and see if there's any questions here. So they'll be picking up some questions from you guys and sharing it with me, and I'll try my best to answer. And I think they advised me to turn on my video now. Okay. I think my video is on. It is on, right? Okay, perfect. So I'll just wait for the panelists to share some of the questions that you guys want to ask. Okay. Okay, so I'm getting this question. So I'm getting a question, it was in Arabic, but I'll translate it for the people who don't speak Arabic. But basically, he's a healthcare worker. He's working in a hospital and he faces pressures about being prone to COVID-19. And his question is, what are some of your suggestions or feedback that I can apply for me and my coworkers? I think this comes down to the facility itself. It's really important for the facility to be part of the process in your own protection. And if they're not doing that, I would urge you guys to ask for these preventative measures, whether it's through wearing face masks or having the right equipment. But more than that, from a mental health aspect, it's being able to have stress management at your work. So having support groups, having ongoing lectures to help healthcare workers and staff deal with their elevated levels of stress during this time and other times as well. And this was an interesting question. What's the difference between fear level and stress level from the infection of COVID-19. So I would say they're correlated. Fear, of course, is part of the anxiety bubble, and having kind of a fear-driven, um, having a fear-driven model against the COVID-19 can be very anxiety-producing. And if you if you basically have more anxiety, then that can also lead to more stress. So I would say that they're highly correlated and would be very hard to separate them, especially during the pandemic. What else? Do our system have any coping mechanism to prevent occurrence of negative stress among healthcare providers? Do our system, I'm not sure what that means, do our system, but the coping mechanisms to prevent the occurrence of negative stress is a lot of the things that I was talking about in regards to finding out your sources of stress, identifying how your stress impacts your body, applying coping strategies like better eating, better nutrition, better sleep, exercise, working with your mind, challenging your thoughts. It was basically everything that we kind of covered. In your opinion, any healthcare provider coping with COVID-19 patients, how he or she should deal with their families at the moment? So that's a very tough question, and I really salute every healthcare worker that is putting, you know, themselves at risk and working during these times. A lot of healthcare workers are going towards self-isolation, and I know that within itself has an impact on your mental health, but it is a means of protecting your loved ones if that is something that you are worried about. And it's something that's very difficult to do, but it's a difficult decision that majority of healthcare workers that are dealing with COVID-19 cases are implementing now. There's so many questions, so I think I'll just take one or two more. Okay. This is an interesting question. How do we cope with stress factors that are not in our control? There's always going to be things that are not in our control. And, you know, constantly thinking about things that are not in your control are definitely not beneficial to you. And I still urge you to do that exercise in discovering what are things that are in your control within things that are not in your control, if that makes sense. So a recommendation is doing 2 circles and writing down what is in my control and what is not in my control. Listing everything that's not in your control so you can visually see it. And on the other circle, try to list things that are in your control and try to focus on things that basically empower you to feel that you have that control on dealing with that stress or anxiety producing situation. This was just a comment saying it's important to spend time with family and close friends. And if it, hold on, I'm sorry. The most important question, what can we do to clear our minds, to focus on what's important for the patient as a worker and caregiver? And if that moment or few hours spent with our loved ones can help us, if it's good for us or not. So I highly believe, although there is social distancing that is being implemented, it does not mean that there's a lack of social connectedness. I think you can create that support system. I think it's important to connect with people, to talk with people. A lot of people that suffer from anxiety and depression can feel that they are alone, and that is something that we would want to move away from. And so the more you feel that you have a support system, the more you feel empowered with your coping strategies, the more you will be able to feel that you have a little bit more control on your stress. And I think that will be the last question, because I just noticed that it is 11:15 and I totally went over the time. So I wanted to say thank you so much for attending the webinar. I really hope it added some value, and I urge you guys to find the resources around you that can help you deal with the stress during this time. And thank you so much to our healthcare heroes. Okay, take care.